Good morning.
Good morning. So I have a few questions about relationship between anxiety and pain.
Oh,
So
okay.
one of first question is, can anxiety create pain when it is not there? Like, can it do that by maybe do it by recreating or extrapolating a painful scenario and then physically manifest that pain?
Okay, so that's two questions. Let's take them one at a time.
Yeah.
With regard to pain, pain is kind of its own definition. So to say if pain's not there, that doesn't make a whole lot of sense to me as I used to be a doctor. So if there's pain, there's pain. And so to talk about pain that's not there doesn't make a whole lot of sense from my point of view, right? But the question is, can
Mhm.
anxiety manifest pain is a good one. And it most certainly can. It can create tension and it can create fear. And both of these make whatever pain's there much worse. They can make it worse. Uh, Anxiety itself is a form of pain, an emotional, uh, mental pain. So, does that answer that part?
Yeah.
Okay.
I
Next
mean,
question.
yeah, so part of that question was, can mind recreate or extrapolate to a painful scenario and then physically manifest the pain? But
Okay,
I guess
say that
that,
again. Say that again slowly.
yeah,
Can the mind?
can the mind recreate or extrapolate a painful scenario and then physically manifest that pain?
Absolutely, and it does it all the time. Headaches are a good example. Tension headaches are a good example of that. The mind generates some situation. The situation causes tension in the neck, for example. That tension in the neck, which because of the way the muscles are constructed, goes up here to the temples, right? And then you have a bilateral tension headache. So, yes, it can create it. And then you said recreate. Yeah, I can recreate the same thing. And then what was the second half of the question?
I think, or extrapolate, basically movement of thought. Like, oh, by movement of thought, I mean observing some past scenario and thinking if we are facing that same scenario right now, so what would the pain be?
Anticipatory pain, yes, and anticipatory anxiety, yes, absolutely. These are very, very common. They're very, very unpleasant, and they're 100% avoidable. But you said movement of thought. That's a very nice phrase. Can you think of any thought that doesn't move?
If it doesn't move, then how can that be thought at all?
There you go. So now we have another characteristic of thought. Yeah. So forgive the aside, but movement of thought is a Krishnamurti phrase, and it's good to get people to just think about that. We take it for granted that thought always has to move. So that's an interesting point. But yeah, no. So people do this all the time. There's psychosomatic pain. There's hypochondriacal pain. There's displaced pain. There's many pain syndromes that are really just from the mind, and the body can do incredible things to create pain and create symptoms and even create skin rashes. I've seen patients, because they're in distress psychologically, create massive skin rashes that look very, I mean, they're definitely skin rashes. They've got the bumps and the redness and all that and the itching, but it's all here, all generated by the mind. We have, although we've made some progress, we have a long way to go in fully understanding the mind body connection. Uh, Enough fear can kill you, right? That's how sudden cardiac death and voodoo death occur. So some people, they have to be susceptible. And there's a few other prerequisites I won't go in now, but voodoo death will kill you. That's how those old witch doctors, used to make a living, I guess. Sorry. Okay,
Yeah.
you want to talk some more about that?
Yeah. So another thing that I observe during when I'm anxious is
Mm-hmm.
I'm hypersensitive to everything. Like I just keep feeling every pain, every small pain that would have gone undetected, but is right now under my radar, and my mind basically tries to assign some reason to it. Most
Correct.
often than not,
That's called
because that reason.
somatic preoccupation. That's the phrase for it.
Oh,
And it's part of a whole set of syndromes. And we can go on. We could say there's 10 of them. We could say there's 100 of different ones. We could say there's 1,000 different ones. Or we could say there's just two or three, somatization, hypochondriasis, psychosomatic displacement, uh, psychogenic, supratentorial. There's 1,000 different words for this, but it's a very, very common feature of humanity that we can turn psychological distress into physical pain. This happens all the time, and the real danger is that people start taking opiates or something like that for what's really emotional pain, and then the opiates relieve the emotional pain, and it appeared to relieve this physical pain, and then the next thing you know, you're dependent on opiates. So people have to be real careful with that. But yeah, so every symptom starts to worry, like, oh my God, it could be cancer, or oh my God, it's going to grow into something else, or oh, I've got something on my skin. Oh, I bet it's skin cancer or whatever. It's a very common syndrome. Very, very common.
yeah. Regarding that
And
last
very, very
point,
painful, I might add. And not at all fun. And it's one of the reasons why we need good doctors that are capable of both understanding this and also treating it with compassion and with understanding, and trying to, explain or otherwise get to the bottom of it, which is psychological. So if you have something like that, I feel really, my heart goes out to you. Really, it does, because it's no fun. All right.
yeah.
You want to say more or ask more about that? That's something that troubles a lot of people.
Uh, I think one final question regarding this, like it may be a bit general one.
Mm-hmm.
So, how can one live life if there is unbearable pain every day?
Good question. There are many different answers to that, and different people manage it in different ways. Some people just, grin and bear it because their culture tells them to. Other people seek solace from the concern of others. Other people, turn to drugs or alcohol. Other people understand that it's part of the human condition, and that complaining about it doesn't help, and running from it doesn't help, and that the mind is a very powerful force in making it bearable or unbearable. And we have to talk about chronic pain or acute pain. And I hesitate to generalize, because every person's different, every culture's different, every situation's different, every injury and source of pain is different, and they all have different colors and qualities. And here you really don't want to generalize, but here's where you want to prepare in advance. Here's where you want to be the master of your mind rather than the slave of your mind, because your mind can go absolutely nuts with severe pain. It can, or you can go absolutely sane. And there's many people who have, when faced with calamity, instead of closing down, they open up, because they realize that if they clamp down on the pain, it makes the pain worse. Whereas when they open like this, the pain is somehow more bearable. Right? These are very big questions about the human condition, but everybody's going to have this at some point in their life. There's just no way around it. Into every life a little rain must fall. And so if you haven't mastered your mind beforehand, it may be a very good impetus to master it afterwards or during. But I can't really answer that question, because that's really an individual question with an individual person, individual situation. You can't generalize beyond a certain point. Now, pain is very different than suffering. And one can have pain and not have suffering. And that's where you want to get. It's where the pain is just pain because of a physical body. And with enough control of your mind, you could get rid of 99% of that with enough. I shouldn't say 99, maybe 97%. But when you add suffering on top of pain, then everything's much, much worse. There's no need to suffer because of pain. Pain is painful enough as it is. I don't know if that kind of makes sense to people. It's an advanced topic, and we can go into it more, but I'd have to have more details about the specifics. All right? Does that make sense? But imaginary pain, the treatment for imaginary pain is to not imagine it. All right? So if you have, going back to the beginning, when you talk about anxiety creating pain, if anxiety is creating pain, the way to deal with the pain is to get rid of it by getting rid of the anxiety. Or if the mind is creating psychosomatic pain, the way to get rid of that is by treating the mind, or fixing the mind, or mastering the mind. They're all the same thing. And there's been many traditions to try and do this. Psychoanalysis comes to mind at the moment. There's a lot of meditation. People say they can get rid of everything, but that's not exactly true. Unless they do more than meditation, they also expand the consciousness. And it's a huge topic, as you can imagine, for humanity. But the distinction should be made between suffering and pain. The suffering is optional. Okay, does that help? I know that's not too helpful, but the question's so general, I can't, unless you're more specific, I can't do much more, I don't think, at this time.
Yeah, okay. So, we can move on to another topic. And
all right, unless there's a specific kind of pain you want to talk about.
I think this is something related to.
Let me just say a few more. I can make a few more generalizations. If there's a contraction, like I said before, if there's contraction because of fear, a contraction of the muscle, that's going to make pain worse. If there's contraction in the mind, a contraction in the body, contraction in the muscles, that makes it worse. So anything you can do to relax that, the muscles, the mind, the body. So that could include hot baths, massages, taking a walk in the woods if you could do that, or not moving, if there's, see, there's so many different kinds of pain. And you don't want to do things that are going to make it worse, but in general, it's hard for me to think of any pain that's made worse by relaxation and by opening and breathing. And sometimes deep breathing can relax everything, for example. But again, those who know do not generalize, and those who generalize do not know. So I should probably not go too far down that road. All right? Okay, go ahead.
Yep. So for past few weeks, I have a certain feeling of pressure at the center of my forehead, like right at the middle of it, right above my eyebrows.
Right here, you're saying you have pressure?
Yeah.
How deep?
And I think it's a bit inside as well, but it's like when during my childhood, we would have some experiments where we would take some pen or pencil and keep it right near our eyes, and you start feeling some pressure.
Oh, really? Tell me about. So you take a pen or a pencil and you put it right here,
and concentrate on the ending of that.
That's interesting. So this is what kids in India do?
So
now what happens when you do that?
Like, you need to concentrate on the near end of it.
What happens?
Like it's like more about there is some pressure, and I
No,
thought
but
maybe
I'm
it's
curious now. As a kid, what happened when you did that?
there was like how should I say, some pressure near my head,
Without
like
touching it. Without touching it.
yeah, without touching it.
Did you have like the? Did you grow up with a concept of the third eye or anything like that?
I have heard of it, but I am not sure about it. Yeah,
And would you
I've
do
heard
it with a
it's.
pencil, or could you do it with your finger? Could you do it with anything? That's very curious. I've never heard of that.
I think you can do it with your finger, index finger. Just concentrate on the tip of your finger.
Not with, but you
You
don't
need
look
to
at it,
look
right?
at
You
it.
don't look at it.
No, I. You have to look at it.
Oh, you have to look at it. Oh, that's your ocular muscles. Yeah.
Okay. Yeah. But it was slightly above than that, like at the center of
How
my.
deep in your skull?
I'm not sure how deep it is. Like an inch,
An
or
inch? Okay. And when did it occur?
it occurred during my meditation sessions.
Okay. And what's the question?
Like, what is this feeling, and should I be worried about this?
Okay. How familiar are you with Kundalini or the central channel?
Not much.
It's
Not much.
fascinating. The every tradition, pretty much. If you look at the Sufis, if you look at the Buddhists, if you look at the Indians, they all have this construct of a central channel in the body for energy, and this energy culls at the base of the spine, and then it moves up this central channel. And sometimes they have parallel channels. The Vajrayana Buddhists, the Tantric Buddhists, they have a parallel channel that goes along here, and they color it differently depending on the tradition. And they voluntarily move the energy up and down. Now, what it could be is that in meditation you're either freeing up or locking up energy there, or perhaps somewhere else, and that's going to create pressure. And so maybe what you could do is try to move it back down or open it up, but gently, 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 and very, very informally. These chakras or energy points are there's different names for them. What do the Sufis call them? I'm not sure, and I don't want to make a mistake. So just relax. Overall, relax. And if you were going to do anything, I would say do no more than just kind of melt it. Try and melt the whole. What do you visualize there?
I don't visualize anything. I was just having
Is it
some
a
feeling.
steady pressure, or is it pulsing, or is it sharp, or tell me more about it.
It was a bit pulsing, I would say.
Pulsing.
Pulsing.
Okay. That's less likely to be Kundalini, unless the freak. How often are the pulses? Is it like this,
Pretty often.
or like this, or like this?
Yeah, the last one.
Is it like a heartbeat rate? Your heart rate?
I don't think so. No.
So it's like this. Or is it like this?
Yeah. I need to remember, to be
All
honest.
right, well, study it. Study it. It's nothing to worry about. Study it. Don't try and intensify it. Try and relax everything. If you want, you can visualize it as a kind of a soft mass of something like akin to love, Why not? And melt it and just bring it back down the channel if you want. Bring it down to the heart. And then open the heart. Right? Open the heart to include the whole world, everybody in it, and all the suffering humans. Poor things. right? And just feel the love that is your natural state, right? For them and for yourself, and how humans, here we are, we find ourselves here on this planet, and we're somewhat lost, and we suffer, and we have pain, like physical pain as well as emotional pain, and we're confused, and we hurt each other, and we hurt ourselves, and just feel the compassion. So I'd recommend something like that, right? Because the things that you're discussing, I'm glad you're doing it, because so many people suffer from the same thing, and real compassion is both for the self and for others. And it's actually in our compassion for others that we relieve our own suffering, frankly. And so when we contract into our, oh, me, poor me, da 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 da, it's just going to be worse, worse, worse. But then when you think of the thousands and millions of people that are suffering from the same kind of thing, not necessarily this, but the other things, that lessens it, and it's closer to the truth, because the boundaries between you and those other people are really illusory. Okay, sir?
Yeah, I think this reminds me of the few statements in Dream Conversations
Oh,
of
good.
Buddhism and Zen.
Dream Cover. That's a great book. That's a good book. And okay, let me say a little bit while we're talking about that. Zen is in danger of being lost, and it is a great loss to humanity, especially now, because we need to get to truth. We need to get to the bottom of things, and we need more people to help with that. And so it's very rare to find authentic books, let alone audible books on Zen. But we have a few, and this is one of them. This is an fairly introductory text on Zen Buddhism by Thomas Clary, who people will start to recognize probably in, 20, 30, 40 years, if we're lucky. And then in 100 years or whatever like that, he'll be, considered saint. He'll be another, I won't say more, but it's rare in the history of humanity to have men like Thomas Clary, and especially as translators. So good. I'm glad you're reading it. What's the question?
I think it reminded me that Master Muso basically says one cannot achieve enlightenment for their own.
That's true. Very good. Yes. No, you can't. It doesn't make any sense, and it doesn't work. And that's the thing, the ingredient that most people are missing when they're trying to get enlightened, and they're trying to do it just for themselves. I didn't really understand this. It took me 30 years to understand this. I mean, I was fortunate in that my situation. Basically, I ran into the Tibetan Buddhists, and they just made it part of the deal. And I thought, well, that's just the Tibetan Buddhists. This notion that you don't become enlightened for yourself, but you come enlightened for the sake of all sentient beings. And it took me 30 years to realize that that's absolutely true. Period. That enlightenment is not something that one gets for oneself. A self cannot get enlightened, right? It's a whole other deal. And so to aim for enlightenment for selfish reasons is, first of all, that's not going to work. And secondly, well, just right there, it's not going to work. And so go ahead. This is great. Great. Thank you for that point. Go ahead. Read this section. It's really, really, really important.
I forgot where. I think it's the first section, I believe, where they discuss this. Yeah, those who seek liberation for themselves alone cannot become fully enlightened.
Yeah, okay, look, the first sentence. Okay. Those who seek liberation for themselves alone cannot become fully enlightened. And I'll say absolutely true, and thank God. That's what I mean. Those kinds of insights aren't obvious, because historically we had one tradition or the other tradition or the other tradition, and they didn't crosstalk. But now that we can compare and we can see the commonalities, it is a commonality for every deep spiritual or philosophical or whatever you want to call it, tradition, all the words fall apart. They all include this. So yes, good. Follow up.
So yeah, I had one question regarding that, and so the for my personal reason for enlightenment is to end my suffering. But is that a selfish reason? So
Who are you?
yeah,
See, as long as you look within your own skin bag for who you are, you're going to be mistaken. And so, if you want to relieve your suffering, you will also want to relieve the suffering of all humans. It's our that's the secret, I guess. That's the trick. That's the reality. The boundaries between you and others. Like this is Krishnamurti talks about this all the time, and I think Eckhart does too. Eckhart Tolle. And so if you want to relieve your suffering, you are humanity. You don't realize that yet because you haven't woken up. But when you do, it'll be crystal clear to you that you are humanity. There's no that boundary that you're creating is not a real one. Separation is the illusion, not the other way around. And so you might as well in the beginning. And this comes from experience, and I can state it strongly now. From the beginning, you might as well understand that the aspiration for enlightenment has to be for the enlightenment of all sentient beings. And it's doable too, believe it or not, in a way that I cannot describe to you. But the Vajrayana Buddhists, the Dalai Lama, those guys know that they're of which they speak, and so, and it's not just them. Zen Buddhists as well. So, yeah, so if you're doing it for you to relieve just your own suffering, then I would recommend there's a basic practice. It's called exchanging self for others. It may be called Tolle. I'm not sure exactly in Sanskrit. But basically, when you're contemplating your own suffering, think about the suffering of other people. How many other thousands of people living today? I mean, you could, if you look at history, you'll break out in tears, right? You'll weep and never stop. But if just today, how many other people are suffering, and how many other people are fearful, and how many other people are worried that they're not going to have enough to eat or have medicine or be able to take care of their children or survive what's coming or whatever. And then that remember, compassion. You can't just have insight, wisdom. You must also have compassion. These are the two wings. And without both, you're just going to fall over. And you'll be an intellectual dry, person who can't wake up because they're too self-focused on their own intellect and their own ego, right? Or you'll just be this bloody mess, on the floor crying because bloody mess. You're this tearful mess on the floor crying because the sorrow is just too much to take. There's a lot of sorrow out there. Okay, sir?
yeah.
Anything else before we stop? I'm going to have to wind up pretty quickly here.
Yeah, I had one question in the
A lot of
maturation
suffering out
section.
there. Go ahead.
I think I have one question in maturation section of the dream conversations.
Okay.
I think it's at page 35.
All right. Softening worldly feelings. Okay.
No, I think it's the title is maturation.
On page 35.
Yeah, 35, 36.
We must have different books.
I'm right now using Kindle version because I have some notes on it.
Oh, you're using Kindle?
Yeah, right
All
now.
right. Try and get the book if you can at all can. It makes a difference. There's a certain amount of...
I do have the book.
Okay, good.
I do have.
So let me see if I can find it.
I think it's near intent and expression.
Spiritual malpractice,
Self-realization.
demons, spiritual malpractice, religious practice, obstructing enlightenment, meditation and madness, quelling demons, aversion and attachment, scholastic learning, practices and stages, means and ends, understanding the Zen koan, medicine and disease, expert advice, maturation. Okay.
So I think this para basically says, after realizing the intent of Zen, people in ancient times used to spend decades polishing themselves thoroughly in order to free themselves from compulsions of conditioning and habit.
Yes. This is called the work
So
of maturation. The completion of maturation is called the attainment of unification. Yeah.
So basically, this implies conditioning comes back after awakening. Or is it
There
like,
are edges to be polished. There are edges to be smoothed off. There are things that are a part of our, that have been so long part of our evolutionary history, for example, or even our cultural history, that they don't just all go away. Well, an acute Kensho, an acute Satori or Nirvana, there might as well be nothing, because you don't operate from memory, you don't operate from thought. But the Satori and the acute Nirvana can only be sustained. I mean, you can't try to sustain it. It's either there or it isn't. There's no trying. There's no person there to be trying. And to the extent there is a person there trying to do anything, then you've lost it. So you would have to be completely free of thought. Pretty much free of thought and free of personal identity. You can't function in the world like that. And so, and that's not the way the thing is set up, to the best of my knowledge and experience. And so, yes, there's work that still needs to be done, absolutely. And that takes decades, that takes a lifetime, right? And so I didn't really feel like I should teach for 30 years afterwards. So for 30 years, I've been doing the best I can. Now I'm working with some pretty raw material, to start with. But I'm doing the best I can. And yeah, that's exactly what that means. All beings work it, all without exception. And, I'm not trying to put myself down. I think the Dalai Lama would say the same thing. As a matter of fact, I remember once he said he was complaining about his own self and his own conditioning. And it was very spontaneous, the way he always is. Love that man. At any rate, he's saying, yeah, I'm supposed to be enlightened and all that. Well, I was on a plane and the pilot said, there was trouble, there was a lot of turbulence or whatever. And I was afraid it was going to crash. And I was worried about myself surviving instead of the other people. So, that kind of thing. Yeah. You still have an animal body. There's a lot more to it, but speculating and talking about things way out there is first things first. Okay, so my friend, anything else?
yes. No.
All right.
Yeah.
We'll take good care. If there is pain and there is anxiety, get rid of the anxiety and the pain will be less. All right?
Yes.
Okay, sir. Take good care. Guard your mind. Ciao.